Hi, my name is Michelle Nesky, the Posh PA, and today I want to break down for you step by step the PANCE, not the pants you're wearing, the Physician Assistant National Certifying Exam, the PANCE, and give you some study strategies for success. But before I do that, if you haven't already, smash the subscribe button because you know I'm here every week dropping tips to help you get into PA school, become a successful student, and a fulfilled practicing PA. All right, so taking a national certification exam can be daunting. You just spent 2+ years of your education learning all of this material, and now it's time to put it to the test in a 5-hour exam, okay? So it is a little bit daunting. However, when you know what to expect and you break down the blueprint, you can adjust your strategies for success. All right, so let's talk a little bit first about the exam itself, just a little bit more facts about the breakdown. So number one, it covers two main categories: knowledge of diseases and diagnoses, but also knowledge and skills related to tasks that PAs perform. It's 5 hours long, like I just said, but don't worry, you do get breaks. These 300 questions are multiple choice, and they are broken down into 5 60-minute sections. So you can get up in between, go to the bathroom, get water, get a snack. Be sure to utilize your breaks when you can, because you want to have your attention full and focused. To register, you need to be a graduate of an ARC-PA accredited PA program and certified by the NCCPA that you can take the exam. If you've graduated from a program, that's pretty much done for you. It is $550 to take the exam, and I would suggest registering early. However, you cannot register more than 90 days from your graduation date, okay? So you want to make sure that the test centers aren't full, but know when you're supposed to graduate, and you can't go earlier than 90 days before that date, right? So let's talk about the blueprint real quick, because this is how you're going to direct your studying. The NCCPA actually gives you the blueprint, like what content is covered on the exam. So it's not a mystery, okay? It's out there for you. It breaks it down per subject and per content. For example, cardiovascular system, 13% of the exam. Pulmonary system, 10% of the exam. Genitourinary system, 9% of the exam. So we're over 30% of the exam already covered by those 3 subjects. You are gonna know where to direct your studying, right? Whereas dermatology, hematology topics, 5% of the exam, okay? So yes, you do need to have knowledge of all the subjects, but it's also really important to know the heavy content areas so you can focus your studying in those spaces. There's also task categories: history and physical exam, diagnoses, ordering tests, professionalism, patient education, health maintenance, preventative medicine. These are integrated with the medical content. So 90% of the exam is medical content, and these task skills will be integrated into those questions. It's also important to note that 20% of the exam may cover surgical topics, which is okay because you did a surgical rotation and you've learned about those things as well, right? So in terms of study strategies for the PANCE, you really want to set a timeline for yourself. So my recommendation is to schedule your exam within a couple of months after your graduation date. Why? Because that material is as fresh as it's ever going to be in your brain, okay? So set a date, work backwards with your study plan. If you're somebody that needs longer than 12 weeks, that's okay. Just make sure that you are scheduling out your date and then making a study plan that works for you with study strategies, knowing how you learn. Are you auditory? Are you visual? Are you both? Are you a tactile learner, right? You need to use resources that are going to help you understand the material and not memorize it, okay? We want to be able to understand what we're studying and be able to apply that to patients someday, all right? So my top 2 tips, my number 1 tip is do as many questions as you possibly can, as many practice questions as possible. That will help you learn how the questions are being asked. It will help you learn how to break down a question so you can narrow down your choices and make an educated guess, or maybe you'll even know the answer, right? So getting practice and understanding the format and the type of content that's going to be presented to you is a really important piece of this. And number 2, follow the blueprint, okay? It's there for a reason. And you want to make sure that you're studying the subjects that are going to be more heavily covered and not neglecting the other areas at the same time. So one of the things I suggest is to just take a practice exam cold turkey, right? Take an exam, see how you do. You can assess your strengths and weaknesses, right? You can see what areas that you need to work on. What modules were easier for you? What topics did you cover? What did you struggle with? Nephrology, endocrinology, right? You can go back and tune into those areas and really adjust your studying. You can also use time blocking. That's a strategy that works for a lot of students. Set a timer for 30 minutes. Focus your studying and energy on one subject for 30 minutes, take a 5-minute break, repeat that cycle 4 times, take a 30-minute break. It keeps your mind fresh, it keeps your energy focused, and really keeps your perspective on what you're studying and increases retention. Both active and passive learning are going to be really important here. So not only doing questions and really being part of that, but also listening, reviewing your notes, and really understanding different kinds of studying that are going to help you retain the information as much as possible. Now, remember, there's no penalty for answering a question. So try to answer every question. And a really reassuring fact, 90% of people pass on the first time, right? If you don't, it's okay. You can retake it again. You can take it every 90 days. Once every 90 days if you don't pass on your first try. And if you don't, it's okay. Like I said, if you are looking for personalized PANCE prep strategies, or if you have not passed the exam and you're looking for help and assistance on how to pass the second time, we offer personalized PANCE prep services at michellenetsky.com. So contact me directly. You don't have to go through this alone. All right. Now, use the tools at your disposal. There are so many study resources now for PA students going to take their boards, way more than when I was in school. And I wish I had some of these: video, question banks, study scripts. I mean, just so amazing. Some of the ones that are out there that are very reputable: Smarty Pants, one of my favorites. PANCE Prep Pearls is a book. NCCPA has a practice exam. Osmosis Prime, Picmonic, Hippo PA. You don't need all of these. Pick 1 or 2 that you feel that are going to fit you best. They're all amazing resources. Some do's and don'ts before your exam, okay? Night before your exam, do not go to a new restaurant. Do not start a new workout routine. Do not cram everything in, okay? Do not do that. Do not reschedule your date multiple times. It will increase your anxiety and stress level, and you'll just build up this test anxiety as you go into it. So schedule a date and try to stick to it. But you don't want to feel physically ill the day of your exam, right? So no new restaurants, no new food, no new workout programs. Don't take breaks during your non-break time and like miss the time that you have to answer questions. Don't stay up late the night before, and don't schedule your wedding, you know, a week before your exam. Okay. No life-altering events. What you do want to do is make sure to commit to your plan, exercise, which reduces stress levels and increases your focus. You want to take care of yourself and take advantage of your breaks, bring water, bring snacks, do all of that. You want to go to bed early the night before and stop studying, in my opinion, 24 hours before, to keep your mind fresh and give your mind a little bit of break going into this. Now, in my opinion, you're never going to know everything. So don't set that expectation for yourself. Don't wait too long, like I said, after graduation to go ahead and take your exam, because that's when everything is so fresh in your mind. There are PANCE and PANRE courses out there that you can take, but as a new graduate, all the resources that you have that I just mentioned should be enough for you to be able to pass the boards. And again, remember, 90% of people pass on their first time. But again, if you need help, we're here for you. I hope this helped break down the PANCE for you step by step and to give you some strategies to study for success. I'll see you again next time.